Good afternoon, everyone. I'm Amy Smollers, Executive Director for the Center of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association, and I'd like to welcome you to today's webinar, Strengthening Healthcare Data Compensation Across Massachusetts. A few logistics before we start. We are in listen-only mode, so please enter your questions into the chat feature, and we will do our best to get them during our time together today. I also would like to take a moment to thank MHA's 2026 annual sponsors, as well as our strategic partners, for their support in underwriting today's webinar, which is just one of many events that we offer to our members to help address timely issues like the one today. I'm now pleased to introduce our presenters from Salary.com. We have Zach Day, who's Director of Survey Management, and Connor Kinney, Senior Partner and Success Manager. Zach and Connor, thanks so much for being here, and I'll hand it over to you to get us started.
Fantastic. Thank you, Emmy. And thank you all for being here today. I appreciate everybody's time and attention to this subject because this is something that has been in the works for quite some time with our partnership with MHA. But happy to talk to you today to further explain how salary can be a benefit to you and your organizations. So once again, just an agenda. We'll do an introduction to who we are as Salary.com. We'll review our partnership with MHA. We'll talk about the healthcare survey that most of you have been participants and are familiar with. And then we'll get into some specifics about the state of the healthcare data. And also, we'll finish up with how to keep up with salary trends. We'll do a demonstration of one of our products, and we'll do a questions and answers at the end. So, once again, I am Zach Day. I am the Director of Survey Management here at Salary.com, and I'm joined by Connor Kinney, who is a Senior Partner Success Manager within our organization. So, to give you a little bit of background of Salary.com, we are everything that it comes to compensation data management. If you've had questions of how do you pay your employees, how do you manage your pay, or how do you deliver pay to your organization, we have a solution available for that. So when it comes to what we're trying to do as an organization, we want to make sure that you are paying your employees fairly, accurately, and on time with certain demographics and information that we can provide to you in terms of the reports and the structure that we provide to you. We have been around for 25 years. So right around the dot-com boom, we started as an organization. We have over 10,000 customers worldwide. We are a global company, and we have customers across the globe and representing 140 countries, which gives us the ability to have over 20,000 job titles covered, and then also 30,000 organizations in our survey alone. So as you can understand, this is what we do. This is what we breathe. This is how we live, is to understand compensation management in organizations and structures within organizations. So before we get into talking about the data itself, I just wanted to clarify two things that will be important as kind of buzzwords that we'll be talking about, but mostly they're products that you need to know the distinction between the two. One of them is going to be the Comp Data Survey Healthcare Northeast Region survey product. Now, this is a employer HR sourced information that allows you to have credible and accurate pay rates for organizations that are producing their survey responses to us. It is a year-round submission, meaning that we have information coming in on a daily basis to our survey. And with that, you get a quarterly report every single 3 months that gives you refreshed information to stay on top of market trends. The other product that we'll demonstrate at the end is Comp Data Max, which is going to be our information that is going to be looking at job posting data. This is real-time evaluation of market pricing. It's updated every single day and also is driven by AI insights that give you information as to what's happening within the marketplace. So as we go through this presentation, listen to those two distinctions, Comp Data Surveys and Comp Data Max, and we'll understand how it's two sides to the coin to understanding the specifics of compensation management. But I want to talk about our partnership with MHA for a second because it's been a fruitful one for as long as as long as we've been partners since 2024. We have had a wonderful experience working with the hospital systems that are members of MHA, and the MHA staff has been wonderful to us to understand specifically what's happening in your state and how we can understand a specific solution for you. And that solution is the compensation management survey, the healthcare survey survey in the Northeast region. What it does is it provides individual state data and localized state data within a region, but it also provides a regional approach to understand what's happening outside of just the state in other specific states and metropolitan areas. So not only will you have access to the Massachusetts data that we are producing, you'll have access to New York, New Jersey, New Hampshire, Vermont, Rhode Island, and so on and so forth. So key metropolitan areas in those states that you may be drawing information and interest from other people that are maybe willing to travel to your systems to have employment. Uh, Specifically, this is a very affordable option of $4.95 for a 12-month subscription. Again, you only are participating once in that 12 months to have access to 4 quarterly reports. And on top of that, any other service past the survey is a 10% off of that with any software and consulting services that we have. So as we've gone through the process of working with you and your organizations and your systems for the last 3 years, we have had a very robust survey response to this. We have over 65,000 incumbents in the healthcare survey in the state of Massachusetts alone, and over 25 participating member healthcare systems, which represents about 65% of all the hospitals in the state that are in that survey already and providing data for us to provide back to you in aggregate form. As you can see, the many healthcare systems that we have on the sheet here, we have every corner of the state pretty much covered in terms of data that we're collecting and that we can provide back to you in terms of the reports that we are giving out quarterly. So the state of Massachusetts healthcare data, I think right now we have a solution that is a strong one. We have over 400 different healthcare and benchmark positions that are populated in the Massachusetts reports. Once again, it's over 65,000 employees that are located in those survey reports. But we also can provide local areas that we can break down into specific regions. This is based off of the counties in which we have in the state to make a metropolitan area or a local breakout area that we can have accurate, really distinct, really specific information as to understanding what to pay employees at your specific facilities. Not only that, we can also provide you with survey responses that can be dissected into different demographics. Things like bed size, revenue size. If you want to only look at hospital only specific information as opposed to healthcare at large, FTE counts in teaching hospitals. This is all available in terms of our reporting through the survey itself that has been the backbone of our partnership with MHA since 2024 and is available to anybody that signs up. Once you do sign up, I just want to let you know that you have access to results right away. You don't have to participate in order to see results like some other survey providers. We give you results right away. One, we want to be helpful. And two, we want to show off the good results that we have already and make sure that we're being useful as quickly as possible to you. So if you are not participating in the survey yet, that's an opportunity to talk to me to get involved with that survey. But I think the majority of the people on the call are familiar with that survey enough to understand that we do have robust information coming to it. So what I want to do next is to showcase the information that we are collecting and showcase some of the positions that have been identified as critical gap positions in your organizations and understand specifically, sorry, I'm getting ahead of myself. This is an example of the healthcare survey. So what it looks like, 2 different sections. But what I want to talk about is the data itself. The data that we're collecting out of this is giving us really good information into understanding the market trends that are happening in the key critical positions that are happening within your organizations. Now, what I have done is worked with the MHA staff and specifically the workforce report that was produced earlier this year, understanding the critical gap positions that you have within your organization and putting a metric, a salary metric to what's happening for those key positions over a trend of 3 years. Now, this is not all encompassing. This is not going to be every single position in your organization. If you want to do a study like that, we can help you with that to understand what has been happening within your specific industry, your specific state, and your specific organization over the course of 3 years. But I just wanted to just give you an example of some of the positions that we have been seeing with large percentages that have been changed or have been identified in that workforce report as a critical gap position. So as we're looking through this is positions that are in thousands of dollars for the annual pay for 2024, 2025, and 2026. As you can see, the differences between 2024 and 2026 the vast majority of them have double-digit growth, including the certified nurse midwife that has a 30% growth, which if you're familiar with that position, you can understand a little bit why that is growing so fast and so quickly is because it's highly sought after and it's highly in high demand right now. But if you're feeling that these positions that are critical to staffing that you might not have been able to have access to or get people into the door to fulfill those positions of need, this might be an example of why that may be occurring. It could be a talent shortage, but it could also be the compensation that you're looking at and what is the going rate of what's being asked for in the marketplace for these key positions. Now, this presentation will be sent out to you so you can see exactly and go through each individual results. I don't need you to copy down all these numbers right now that we're going to go through. You'll have this report available to you to see through specifically how this has changed over the course of time. But I wanted to give you an example of some of the key positions that have had drastic change because by and large, compensation has been increasing since basically the pandemic. So, when we look at a regional approach, so again, taking a look at the states that are part of the region that is a part of the Northeast, states like New York, New Jersey, Vermont, New Rhode Island, Maine, states that you might be pulling talent from into your state. We can understand specifically how those other metropolitan areas are affecting your pay in the state. We can take a look at the last 2 years, but specifically, I want to showcase the last column, which is going to be the difference of the regional pay versus the Massachusetts pay. And you can understand that there's some that you have been paying more for talent than the region, and some that you're paying less than the region. And this is very typical of what we see out of a regional approach. Now, you are in the same region as metropolitan areas like New York City, Philadelphia. I doubt that you'll be pulling from DC, but DC is a part of that area too. So some major metropolitan areas that are going to be that's going to be influencing these the pay rates that go into the regional approach. So as we can go through this, you can see that your state is going to be a combination of both paying more for certain positions and paying less for certain positions based on the talent that's around you and the deficit of positions and people that can fill those positions in your specific state. Generally, you're going to see that Massachusetts in the national approach is going to be larger and more pay than what has been paid off of the national approach. So this is going to, again, as I've talked with many hospitals in the state of Massachusetts, maybe not surprising that the Massachusetts data in Massachusetts is paying more than a national approach, but maybe is the verification of the gut feeling that you have as to why that is occurring. So when we take a look at national data across the board, Massachusetts is paying more on average than the national data. Again, this is the thousands of organizations that we work with across the United States that are supplying data points to us. Massachusetts is a hotbed of compensation increases and compensation needs. So as again, you'll have this report for you. You can dive into it. Please email me, ask me questions about it. I'm happy to go through some specifics with it. But this is the state of where we see the national approach that Massachusetts, again, probably verifying a gut feeling, is paying more than the national average, is paying mostly on par with a regional approach, and has key positions that have been seeing double-digit growth across the last 2 years. So how do we keep up with salary trends? Again, we have this report available for you. Again, 65,000 incumbents in the report and over 400 different positions that you can take a look at a quarterly report of information. Again, it's HR credible data. It is data that is accurately provided back out to you in terms of the aggregation, again, following the Department of Justice guidelines. But really, this is knowing what the market is paying because it's past data. It's data that we have collected and have to analyze and then produce out into a report. So it's data that is not necessarily what we call real time. So it's understanding what the market is paying for positions. The other side of the coin, in which I have a coin up on there, is understanding what the market is willing to pay. And that's where we come in with the product Comp Data Max, which shows the job posting data that's available on job boards across the United States and also local websites that are collecting data and collecting job posting information that we can start to see now that states and now are requiring it, and now that organizations are also posting job ranges. We can start to pull that data into a understanding of what is happening within the marketplace and knowing what the market is willing to pay. So it's two sides of the coin. You have to know what is being paid, but you have to understand what is willing to be paid in the marketplace. And with that, I'm going to turn it over to my colleague Connor, who is going to be doing a demonstration on Comp Data Max so you can see specifically how that works. Thank you, Connor.
Thank you, Zach. Thank you, everybody, for having me. So we're going to take a dive in now and take a deeper look at that job posting data that Zach mentioned that lives within Comp Data Max. So let me share my screen. Somebody just wants to give me a thumbs up that they can see it.
We can see it.
Looks good. Cool. So as Zach said, this is the other side of the data coin. We always like to think about compensation in two sides of the coin. One, like he referred to, is the comp data study. We love that data because it's accurate. We know that it's vetted. We know that it came from HR professionals like yourself. So it keeps the ranges very small, and it gives us a great insight into what organizations and hospitals are actively paying their employees. But like he said, there's that whole other side of the coin of that job posting data. That's going to give us insight into not just what our employees are seeing, but our potential employees are seeing. And that's huge because when we think about comp, you could pay someone at the 75th percentile. And on paper, that's great. We're paying them a high rate. But if the hospital across the street is offering $5,000 more, 75th percentile doesn't matter any longer. That $5,000 talks, and the employee is willing to leave and go across the street. So if we only rely on one side of the coin, we're not going to have the full picture. So that's what we're going to take a look at today. And this is job posting data that our AI aggregates. Before I hop in and show you, I always like to be clear about the methodology behind this data. Most job posting databases can be a little inaccurate, right? When we think about sites like Indeed, Glassdoor, I can go on Glassdoor right now and self-report $1 million salary. I do not, in fact, make $1 million. I wish I did, but I don't. But even though I don't, it still becomes a data point, and it's certainly not a data point we would ever want to rely on. Same thing in pay transparency states, of which Massachusetts is one. What do companies do to get around that? They'll put a range of $30,000 to $350,000 for an entry-level position. Once again, it's a data point, but it's not a good data point. Certainly not one we would want to use while comping our current employees. So our system is built very differently. The way it works is every night at midnight, our AI goes out and scrapes every single publicly available job posting on the internet. Then it compares the ranges within those postings to our HR reported data, our comp data, our comp analyst data, which we know is that HR reported data and very accurate with those small ranges. So if it sees my $1 million self-reported salary or a $300,000 range spread for a janitor, it knows that that data is outside of bounds and it will omit that data. So it's only going to be returning to you the most accurate results. But then it's going to take the next step, which is even really cooler. We can use a broad term like a nurse. I'm sure you folks are familiar with that specific position. And there's lots of kinds of nurses, right? We have entry-level nurses. We have wound and enterostomal nurses, ICU nurses, specialty care nurses. It goes on, right? And those jobs are all very different. And you folks from organization to organization may be calling those a little bit different titles, but at the end of the day, they're the same job. So what our system is doing is it's taking a nebulous keyword like a nurse, and it's comparing it into our HR reported job taxonomy and matching it to our benchmark jobs. So for instance, if I know I'm looking for a staff nurse RN2 with this very specific job description and level, I know that when I click this nurse, it will only return me results that are applicable to this job. It's going to get out all my wound nurses, my ICU nurses, and make sure that we're comparing apples to apples. And that doesn't necessarily mean that your competitors and peers are calling it a staff nurse RN2. It means that their job description and competencies and skills match directly into this specific job. So I'm going to click that nurse and we'll take a look at our staff nurse RN2. I think Massachusetts would probably be an applicable search area here. It found a lot of them. So we'll search the platform and we'll have it return any results that are applicable. I will give everyone the disclaimer, their system will move a little faster than mine. I have about 50 countries I'm loaded for. So this is really cool. We have job description listed, level. We can look at the competencies and skills. We're given a median salary, which is right on par with what Zach demonstrated earlier with what we're seeing with that comp data survey. We have our spread as well. But now we can get into some data that can't be gleaned from HR reported sources. The amount of postings is going up by 22%. The amount of hiring companies is up by 27%, and it's taking 11% less time to fill these roles. This is something you folks already know, but it is definitely an employees market for nurses in Massachusetts. We have the data now to support that. We can look at the salary trends and how it's been moving throughout the year. We can even forecast that out and blend them together. And our data thinks that after a little bit of a dip this summer, we're going to have a more steady increase. And now we can see who are the companies hiring within these roles. I'm sure some of these look very familiar to you folks. Who's posting the most? Who's paying the most? Who's paying the least? Who's taking the longest to fill these roles? Who's doing them the fastest? Some really great insight here. Then we have the most highly compensated skills within these roles. I love this section. This tells us that medical record systems, which we define the skill very specifically as this, we even have interview questions that you can use to make sure a candidate can speak properly to this competency and skill. What it tells me is that medical record systems are only represented in 6% of these postings, but those postings pay 6.5% more. So if we have an existing employee who's very good at this task and is up for review, might want to take that into account. Also, if we're bringing in a new nurse who's really good at one of these skills, we might want to take that into account in the offer. Then, of course, we have the postings themselves. And we can look at it a whole bunch of different ways. Right now, we're looking at it based off geography. So we can go see what's available in Boston. We have all of the different organizations here. Beth Israel has a bunch of jobs out in Boston. We can look at these jobs. We have the postings. You see the range source has the posted range. We have matched competencies and skills where our AI has gone in and read through the posting and matched those skills to our HR taxonomy. We can feel really comfortable using this as a data point, knowing that we have all of these matched skills and a posted range. We can actually look at the exact posting that Beth Israel has out on their website. There it is. It's a great posting, definitely something you can feel comfortable using as a data point. And this will give us that insight into our immediate competitors and peers and our geographic locations. The data can be scoped down very easily. We can look at specific companies. We can look at specific titles. Industry, probably not applicable here, but we can if we want. And even if we want to get more specific than just Massachusetts, very easy to break it down and look at what's available in Worcester now. See, that did immediately change our median salary by about $1,500. We could start seeing who's hiring within these roles. Very cool. But we don't always have to look at it based off job. We can also search for specific competitors and peers. And there's a few ways we can do that. The first would be search a company. Right here, I can type a small company called Amazon. You've probably heard of them before. We could see every job they have out. So if one of your hospitals had an Amazon distribution center or robotics lab move into the area that was affecting the workforce, very easy to go in and take a look at those jobs. But what's really powerful is we can also create a peer group report. You see, I've already created a Boston hospital group. I just grabbed 14 random hospitals and threw them into a group. But you can add any organization you want. It doesn't have to be healthcare. By just clicking on the Add a Peer button and start searching. We can break that down by geography, industry, and company size as well to help cull the list. But I'm going to run our Boston hospital report, and this will give me everything that's available from all of these competitors and peers. So we can have some immediate insight into what the hospitals that are like us and we're competing with talent have out. Here they are. So we can look at it based on geography. I like the company view. And here are all the postings. So if you know you had a nurse that was looking to go across the street to Mass General or Beth Israel, We can immediately look in, find that job. Here's my staff nurse too. They have 13 positions out. And we can start viewing those positions as we need based off geography. And then finally, the last quick thing I will show you is we do also have the ability to run data insights off of these peer groups. So once a peer group has been created, we can start viewing advertised salary trends, cumulative hiring activity, lots of different insights based off our peers. And that is a very quick drive through of Salary IQ and Comp Analyst Market Data Max. I'll kick it back over to Zach so we can take some questions and answers.
Perfect. Thank you, Connor. So sharing my screen again, just want to let you know that we are providing a specific special price for the Massachusetts Hospital Association of $500 for 150,000 credits, which is around 150 searches, with additional credits after the next participation in the survey. So you must be able to be, you must have the CompData Healthcare Survey already purchased and working with us and participating in order to receive this discount to see the CompData Max product. You can add it anytime. If you want to add it now, please give me and Connor a call. We'll happy to do that. But if you want to take some time to evaluate, we're happy to set up some other demonstrations. We'll have phone calls with you, no problem with that. You can add it at any time if you're currently in a 12-month subscription. So, in the recap of everything, some helpful reminders. We are here to make sure that your compensation management needs are met. You understand pricing and what's happening in the marketplace. You can have consultations with myself or our consulting team. We also have the software management, so tools like CompData Max that can help you with understanding what's happening in the marketplace or managing your compensation. Participation does get easier over time, year to year. If you have been with us for some time, you can understand that we save results and you have to make those spot adjustment changes year to year after that, so it makes it very easier. But if you have trouble with your spreadsheet, we have analysts that can help you with that spreadsheet. If you have an HRIS file that you can provide to us, we can build out that spreadsheet for you. If you want to have job matching help in the process, again, our analysts are there to help you. Please get in contact with me. Please get in contact with Connor. We're happy to help with that process to make sure that your participation is as easy as possible. But the partnership with MHA and the healthcare survey, again, is only as strong as you make it in the organizations and through the associations. So the more participation, the more people that participate in the survey, the stronger the data gets out of this system. So again, want to make sure that we thank you very much for your time and effort. I do see some questions in the chat, maybe. I did not look at them yet. So I'll kick it off. Amy, is there any questions that you have for us?
No, I was just gonna, echo the thank you for sharing this. It seems like a really great resource for our members. But as you said, it's the best when more people, can participate in that.
Agreed.
And we do have time for one question, and there's one in the chat around the data points that you shared with Massachusetts versus the national data. Were they at the midpoint of the range, or did you have thoughts on that particular?
Yeah, that's a great question. I did do the midpoint for my evaluation in all of these. So that's the 50th percentile of the results that we've collected out of that survey, which we call the midpoint. So yes, that's a good explanation to that. I should have clarified that specifically. Those were all midpoint evaluations based off of Massachusetts data as well as the regional and national data.
Yeah, thank you. And to echo you, and our audience well to anticipate what
Correct.
what the data points would be for that.
Correct.
Again, thank you. And as you shared too, we will send these slides along with the recording and contact information and supplementary information from you all to our members. And again, we appreciate you taking the time with us this afternoon, and for folks for attending. And don't forget, we have additional events coming up, and you will be at our Workforce Summit that's happening here July 22nd, which is
Yes.
one of our favorites. They're all our favorites, but as one coming out with a very important topic around our workforce development and pipeline recruiting here in Massachusetts. So we look forward to seeing you all. And Zach, I know you'll be in person for that one. And
Correct.
those who are attending today, next month. And have a great afternoon, everyone.
Thank you so much.